welcome. Dr. Brown from K&S Chiropractic, located Eldersburg, Maryland and Owings Mills, Maryland, both outside the Baltimore area. So this is Anna. What happened with Anna is she rolled her ankle this weekend. Anna, tell them exactly what happened.
So I was playing indoor soccer and I went in for a tackle and basically my ankle just twisted. Having pain in my ankle as well as in my knee. I guess my knee kind of twisted as well when I was going in for the tackle. So.
Okay. Anna thinks she's playing football. She's tackling people. But anyway, so when I saw her on Saturday, she came into the office. It was very, very swollen and inflamed. We really couldn't do anything to it. So I had her do what we typically do when somebody has a sprain of their ankle, and that's the acronym that most people have heard of, RICE. Rest, ice, compression, and elevation. We do that so then everything will relax. It'll be able to make it so we can get in there and work the tissues. When you sprain your ankle right in the beginning, it's way too swollen to push on and do therapy to. But this is what we're going to do today. The first thing that we're going to do is we're going to work some of these muscles and some of the tendons that come down the leg because she's having pain. As you can see, I marked these areas for where we're going to dry needle it. But all up in this upper part of the leg where it's inserting into the knee, and the muscles come down the lateral aspect around your ankle bone and through here. So this is where she's having a lot of pain. It was a lot more swollen when I saw her earlier this week and up through this area. So I'm going to show you how we work these tissues. We weren't able to do this initially because things were so sensitive. So this is what we're going to do. We're going to take some of this and hopefully it won't rub off the gel too much or the marks that I made. And we're going to strip down some of these tissues down in here. And it's pretty painful when you do this to somebody, but it needs to be done, especially down through here and through the ankle. And I know she's jumping, and this is because you can get a lot of scar tissue that builds up on the ankle. I'm not gonna sit here and do it the whole time, but we would typically do this for a good 5 minutes or so. And what we would do is we would strip down this whole muscle, and she will feel tender because there's gonna be a lot of pockets of inflammation and irritation through this area. Now, we do this because we don't want scar tissue to build up. Scar tissue is going to build up around the ankle in this area. Now, the problem with scar tissue is it's a very junky type of tissue. So you don't want that to build up. When a joint is healthy, tissue's laid down in a nice organized fashion like this, and it stretches and it moves well, non-painful. It's great. This is the way it should move. When a joint is irritated, your body lays down tissue to that area. What we want is we want that tissue to lay down in a nice organized fashion. If it doesn't, it lies it down like this. This type of tissue is not elastic. This doesn't stretch. When you get scar tissue and junky tissue through this part of the ankle, this is what leads to chronic pain and chronic irritation in that area. So we want to make sure that we work these tissues so that doesn't build up. So what I would do is I would get in here and I work through these tissues, and I know it's going to be tender for her. And then what we would do is take her foot, you could take her foot through some of its motion a little bit, up till tolerance, and I can feel it moving, and I know it's tender for her, but it's not as irritated as it was during the week because a lot of that swelling's gone. And we would work through this whole area, especially down through this anterior talofibular ligament, which a lot of people can have a lot of problems after they sprain their ankle. So you can use your hand. You can go on Amazon. You can buy one of these. Just this roller, and you can strip the whole muscle, and you can work down this for a good 3, 4, 5 minutes and work that and up through this upper part of the ankle. Now, one thing you want to do if you try to do anything at home to help this heal, when you get down to this ligament here, what you really need to do is you need to go across the fibers, and that's going to be in this direction. Most people have a lot of pain in here when they strain their ankle. So to tolerance, you put one finger on top of the other, and you can work this. Now, if I would do it, it's tender, and it can be very tender. And even when you do it at home, it can be tender. But what will happen is after a few minutes of doing this, kind of gets a little numb, the tenderness goes away, and that's good. And you can do this once a day, once every other day, to make sure that you don't get too much scar tissue in that area. So that's what we do for that. We did some ultrasound earlier. Ultrasound will help to reduce the inflammation and the swelling down through this area. Now what I'm going to do is I'm going to dry needle her. So let me show you how we do this. We're going to use 1.5 to 2 inch needles, maybe a little shorter around that foot. This usually isn't super tender, but we'll see how it is. We're going to be here over this. This is more your lateral aspect, your anterior tibialis muscle that runs down here, your peroneus muscles. So we're going to dry needle this. Now we're dry needling it to help reduce some of these spots. Now these were very tender for her, and some of them have disappeared, but I can still see them. Really tender, she was wincing. So we want to try to get rid of these trigger points. Trigger points are area spasms that form within the muscle, areas, pockets of inflammation. We want that out of there so it'll heal well and reduce her pain. So here you go, let's start. Not really painful. She might jump a little bit depending on how far it's going in. And when we get down to the tendons here, it might be a little more tender, but that's okay. We need to stimulate those tendons. Tendons don't have a good blood supply. So we need to stimulate them so then hopefully your body will come to that area and bring blood to that area to help heal it. A little tender?
A little bit.
All right. Be tough. And there's not a tremendous amount of tissue, so the needles are not going to go in that far. And she was very tender over this one, so we'll kind of see how that does right through there. I know that's tender for her. And then we're going to go down this leg. She had this was tender for her here and very, very tender in here. And we're using 1.5 inch needles here. A couple more to do. And I'm going to go down to a 1 inch needle through this area just because there's so little bit of tissue down here. This is more where the tendons are starting and where they're going to go into that leg. Yeah, I know it's sore. And then we're going to go right around this ankle, right around the ligaments here, right around these tendons that pass through there. I know, right? Sometimes it's a little tender. So I'm just going to get 3 of them because there was 3 marks that we made. There, ouch, and we'll go right up here. And this one might be a little tender. This is right where that ligament is. That good. All right, so look, what we're going to do is we're going to leave these in here for about 10 or 15 minutes. And what they're going to do is they're going to help to break up the trigger points that form around this area, some of them down here, and by going in the tendon, like I said, it's going to help to relax the tendon. It's going to help to create a reaction where if you irritate something, your body will come and try to heal that. And that's what we're going to try to do in here. So I'm not going to stay on camera the whole time, but after she does this, what we'll start doing is a little bit of rehab to that ankle. And we'll put her on, we have a wobble platform, which will help to gain stability in that ankle. The problem with the ankle, especially down through this area, when you roll your ankle, if you do not treat this properly, the ligaments become overstretched, scar tissue builds up, and somebody will repetitively irritate their ankle. They'll roll it. Anybody that's rolled their ankle will know if it doesn't heal well, they'll roll it again and again and again, and that's what causes damage. So we don't want that. So we need to make sure we get rid of the swelling, get rid of the inflammation, get the tissues to heal well, and then do some things to rehab it to get some stability in that area. All right, and I wanted to thank everybody for watching. Please sign up for my YouTube channel and click the subscribe button. We'll see you next time.